Good morning, good morning. I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is your daily medical tidbit. This is Breast Cancer Awareness Month, and I see a lot of activity. I see folks walking and raising awareness, and that's really, really good. And we need more breast surgeons. We need more equipment, whether it's MRI machines, mammograms, the folks that pathologists that can read the results of biopsies and things like that. But I want to talk about risk factors for breast cancer. Okay, I think that is important because we really don't talk about the risk factors of breast cancer per se. And it's been a long weekend, so I'm going to take a sip. There are things that's considered non-modifiable risk, right? The word is self-explanatory. Cannot be modified. Age, right? Risk increases with age, especially above 50, right? Gender is another non-modifiable risk, right? Being female, obviously, is the strongest risk factor. There's familial history and genetics, right? There's BRCA1 and BRCA2 that we hear a lot about, and there are other mutations that correlates with a strong family history of breast cancer. And not just breast cancer, but ovarian cancer also. Okay? So that's important to know. And also your personal history. If you have a previous breast cancer or a certain benign breast cancer, like something called LCIS, right? Then that puts you at risk also. So you have to understand that. Any type of radiation exposure, especially to the chest area during childhood or even adolescent, such as in the treatment of lymphoma, increases your risk. Okay? Now, interestingly, though, ethnicity is considered a non-modifiable risk. There's a higher incidence, think of this, there's a higher incidence in white women in the United States, but higher mortality in black women. Okay, I think there's several factors that go into that, right? Including the not the trust of the system, the delayed diagnosis, and all these things. Another non-modifiable risk factor is your menstrual history. Your menstrual history, that is important. So if you get your period, early, less than 12 years, or late menopause, greater than 55, then that increases your lifetime estrogen exposure. Okay? So it has to do with estrogen. So if you have your period early, you have a longer time exposed to estrogen. And if you have your menopause late, that also increases your exposure to estrogen, increasing your cancer risk. All right? Now then there comes in the hormonal and reproductive factors. There's a term called nulliparity. That means you never had children. If you never had children, that increases your risk of breast cancer. All right? If you have your pregnancies later in life, greater than 30, that increases your chance. All right? Even not breastfeeding or shorter duration of breastfeeding increases your risk. And all of this has to do with prolonged exposure to estrogen, right? So if you're taking any hormone replacement therapy, especially if it's estrogen and progesterone, then you're at risk. The extensive use of oral contraceptives have a slight increased risk, okay, of breast cancer. Again, it has to do with estrogen. All right? Now, there's lifestyle and modifiable risk factors. Let's get into that. Alcohol consumption, right? Because alcohol affects how estrogen is dealt with in your liver. Okay? Obesity, being overweight, can be an issue. Physical inactivity, Your diet, high-fat diet increases your risk of breast cancer. And don't forget smoking, especially long-term or if you start at a very young age. Okay? And this is very, very interesting to know. Now, another thing is when you have your mammogram, you have to look at the breast tissue characteristics. Dense breast tissue on mammogram increases risk, and it makes your detection harder. Okay, so what is underlying this tissue? All right. Other medical factors such as diabetes, which is linked with obesity and insulin resistance. Okay, and one interesting fact that I read was night shift work because it disrupts your circadian rhythm. Okay, and obviously environmental exposures. Right, there's a lot of pollutants out there, and a lot of it sometimes is not due to the individual fault. It's usually, government and agencies, what they're dumping, what pollutants are up there, what's in there that's endocrine disruptors and things like that. Okay, I just wanted to bring that out there so people can understand the risk factors for breast cancer. So breast cancer risk is influenced by a combination of things: your genetics, right? Your hormonal exposure, your lifestyle, environmental factors. Some cannot be changed, right? Your age, your genetics, right? But if you could control your weight, if you could exercise, if you could limit your alcohol consumption, right? Then those things are modifiable. All right? I want everyone to be aware. Let us educate ourselves and take it from there. Have a great day. Peace.